Hi, my name is Nurse Maria. Dr. Guorgui and his surgical sedation team have put together these instructions for you. They are designed to help you heal quickly and comfortably. Congratulations on your implant placement. Now that you're home, let's review a few things. For those of you who had sedation, we ask that you not drive for 24 hours and to avoid alcohol consumption for 24 hours. Please do not spit. If you feel like you need to spit, we'd rather you use a paper towel and wipe the inside of your mouth. Spitting will only encourage more bleeding. We also ask that for those who do smoke, to try to refrain smoking for several days, if not weeks, following your implant placement. Smoking will only increase chances of infection and implant failure. Let's talk about bleeding. With implant placement, bleeding is quite minimal. If you are bleeding a little bit, please expect that you're going to have some bleeding several hours following your procedure. For those of you who've had implant placement on the upper area, sometimes some people could have a little bit of oozing or bleeding from their nose. If that were to occur, do not be alarmed. We only advise that you pinch your nose and allow the bleeding to pass. If we placed implants close to the sinus area, we will advise you to not use a straw following your procedure for up to a week to 10 days. Healing process. When we place an implant, that implant will take several months to properly consolidate in the bone. For that reason, we ask that you avoid placing any pressure or applying any pressure to the area. This includes any hard foods like nuts. We also advise for those who had grafting done that you not apply any finger, tongue pressure, as well as avoiding lifting your lip to see the sutures. All of these things can affect its viability. Swelling is normal. Expect swelling day 3, day 4, day 5. Those are typically the days that you will see bulk of swelling. The best thing to do to decrease the swelling are a number of things. Number 1, ice your face. So for those of you who had implant placement done on just the one side, you're going to place an ice pack on the external side of the face for 20 minutes on, 20 minutes off, 20 minutes on, 20 minutes off, and you want to do that for the duration of today and tomorrow. For those of you who had implant placement on both sides of the face, you can do 20 minutes on one side, 20 on the other, and then keep alternating for the remainder of today. Number 2, elevate your head. That elevation today and tomorrow will help keep the swelling down. Number 3, if Dr. Guorgui prescribed you an anti-inflammatory, we ask that you continue with the anti-inflammatory for several days following your procedure. The anti-inflammatory will not only help decrease discomfort, but it will also help alleviate any swelling that you may develop over the next several days. Don't be alarmed if you see a little bit of bruising on the outside of your face following your implant placement. These are all things that will improve gradually with time. What can I eat? That's usually the first question most people ask. Now that you're home, go ahead, have something to eat. But know that there are a few restrictions. It's temporary. You're pretty frozen, aren't you? That freezing is going to wear off gradually over the course of today. But it can make things rather difficult in terms of your swallowing. It's temporary. That's why we ask that you start on a non-chew food item as soon as you get home, like a broth. Once that freezing wears off in a couple of hours, then you can go ahead and start having a soft food diet. Your soft food diet is going to be continued for at least 7 days following your extractions. A soft food diet is anywhere from pastas cooked really well, to yogurt, to ice creams, to fish, maybe a milkshake. Avoid that straw. Stay well nourished, well hydrated, and you'll heal faster. In terms of temperature, cold is perfect. Ice creams, milkshakes, it feels good, it'll help with the inflammation. Temperature hot, not so much. Hot will, one, promote bleeding, and two, if you're really frozen, you can burn yourself and not even realize it, so be careful. Allow your foods and beverages to cool down to a room temperature. Let's talk about brushing. Now that you're home, we are going to advise that you not brush your teeth or rinse your mouth today. So no brushing or rinsing today. Starting tomorrow, you may go ahead and start brushing your teeth, avoiding the surgical areas. So we want to leave the surgical areas alone for a week. In 1 week from now, we're going to ask that you start using a soft toothbrush, the little bit of warm water. You're going to gently brush the gum area where we place those implants and where those sutures are in place. Dr. Guorgui might have used 2 different types of stitches. One is a suture that is dissolvable and will fall out on their own, and another one is a non-resorbable suture. That means that you'll have to come in several weeks and Dr. Guorgui will remove those stitches for you. We'll advise you which stitch we use at the time of your procedure. If we placed a healing abutment, you'll see that protruding through the gums. It looks like a metallic steel little piece sticking out through the gums a little bit. In 1 week from now, when you start brushing the area, we ask that you also brush the steel button around it. Sometimes food can get trapped around that steel button, causing excessive inflammation in the area. So we ask that you do a great job keeping the gums free of plaque. Rinsing. Again, we're going to ask that you not rinse your mouth today. Starting tomorrow, we're going to ask that you start with that medicated mouth rinse that Dr. Guorgui has prescribed you. The medicated mouth rinse works as an antiseptic that's going to help kill the bacteria in your mouth and prevent any infections by occurring by reducing the bacteria in your mouth. We ask that you start your mouth rinsing a day following your procedure. You're going to take a little cupful, gently swish in your mouth for 30 seconds, and open. Don't spit aggressively, but open and let the water drizzle out of your mouth. You're going to do that 5 times a day. We're also going to advise that you use warm saltwater rinses in between your medicated mouth rinse. Just take a cupful of warm water, half a teaspoon of salt, and again, swish for 30 seconds, open, and let the water drizzle out. We ask that you not use any alcohol-containing mouth rinses for at least 1 week following your procedure. Dr. Guorgui might have prescribed you several medications following your procedure. We ask that you carefully follow the instructions given to you by your registered nurses. If you experience any nausea, vomiting, or diarrhea with any of the medications we prescribed you, we ask that you please contact us. We look forward to seeing you. If you have any questions or concerns, just reach out to us. We're available anytime.